Right now, there are some 37 million Americans who are suffering from chronic kidney disease, which leads to kidney failure. But recent Medicare policy changes have moved life-saving medicines into something called the end-stage renal disease, or the ESRD payment bundle. That bundling has resulted in limited coverage and access, ultimately literally putting millions of American lives at risk. So I know both of you have a sharp eye on healthcare. You look at it from different perspectives. You try to collaborate as often as you can. But top of mind is the healthcare and the well-being of the American people. So my question would be, how would you suggest that we solve this problem to ensure patients gain access to life-saving medicine?
Yeah, I mean, when you're dealing with kind of dialysis centers, a lot of it has to, we have to ensure that, number one, they are functional, that they are profitable, or else you're going to end up having a scarcity issue where they're going to end up placing dialysis centers only where it's closer to the client, and end up, having people driving miles and miles away. So, usually when dealing with the type of situation you're talking about, we work with CMS to see if there's a way for us to make sure that there's equitable payment for service, because we don't want dialysis centers going under, because the first places they'll cut are going to be poor Latino areas, poor Black areas, Native American areas. Overall, I think the thing that I dislike about our healthcare system is that we treat, and we're very good about treating things when it's already bad. We don't actually put the effort in on the front side of things to stop people from getting really sick. What does that mean? Well, by the time someone gets diabetes, it's already too late, right? We're going to do the best we can to stabilize, you for the rest of your life, but you're going to have diabetes for the rest of your life unless there's some breakthrough that comes through, and that's a whole other Kennedy issue, but we won't get into that today. But we don't actually focus on how to stop diabetes, right? So some of it is, health. Like, are you exercising more? Are you eating well enough? The population that's likely to get diabetes is actually pretty predictable. If someone in your family has diabetes, you probably are going to get diabetes too. It's not just genetic. It's also just because the things that cause you to lead you to get diabetes probably have not changed. The nurture versus the nature section. And then there's the opportunity for us, I think, to think outside the box. I think a lot of times we think of diseases as a form of like virtual punishment. And instead of understanding that this is a big problem that we need to fix because it will end up breaking Medicare and Medicaid and even private insurers, we need to stop thinking about that. And so I'm a big supporter, and I think there's a couple of Republicans who have joined me in trying to make GPL1s more prevalent and cheaper, and trying to get communities that are extremely exposed to likely be have become diabetic or cardiac disease, and getting them early on, your Ozempics, your Zepbounds, will end up saving us a lot of money, especially if we could negotiate the price of these GPL1s down to the point where, we can give it out to these very vulnerable populations. But the amount of money we're going to spend taking care of somebody that gets diabetes at the age of 30 and probably has a lifespan to the mid-70s is astronomical compared to what we could do if we actually help them manage their weight through some of these breakthrough technologies pharmaceuticals. The problem you have is that we go into the American public and say we're going to give these poor people, and that's largely what we're talking about, of color, free to low-cost Ozempic, you will see people lose their minds, right? But in the long run, it will end up saving the taxpayer billions of dollars, potentially trillions of dollars. And so we have to get over this stigma of somehow, people that have diabetes do not deserve, or potentially have diabetes, do not deserve preventative medicines that could end up saving their lives and saving all of us a lot of money.